The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome back to Ageless Health with yours truly, Dr. Tom Roselle, and another great program for you today. One that's kind of been piggybacking on other programs that we've done over the last few weeks, and it's talking about your hormones. And we just discussed that quite a bit on radio program WMAL 105.9, which we do every Sunday at high noon in the Washington metropolitan area. Program that is owned, operated, and distributed, if you will, by Cumulus Radio all over the country, and hopefully that you've had the opportunity to listen. But it's all here for you as well, and we want to make sure that you have the opportunity to assimilate information ongoingly. Coming up this coming Wednesday evening, the 19th, at the Roselle Center for Healing, we're going to be talking about this topic. We're going to be talking about hormones and how they can predict your health moving forward. If they're not working the way they're supposed to be, if they're not in the balance that they should be in, guess what? You may not have an easy time as you begin to go through, the days, the weeks, the month, the years ahead. And wouldn't it be nice to know if it's predictable and then you could do something about it, but you could do something about it in a natural way? I don't know about you, but this old boy, I'm always on top of that on an ongoing basis. So let's get into the program a little bit. I want to talk about how injury, trauma, blows can affect hormonal balance, hormonal production, and its communication throughout the body. And ladies, pay attention, because this can affect you actually in many ways more so than guys, and for a lot of reasons. But let's get into it just a little bit so you understand, if you will, how hormones can affect that flow and so forth, that they've been kind of triggered by a bad injury, bad fall. So injury can significantly impact hormonal flow, production, and balance. Again, especially ladies in you, if you're an athletic person of any sort. If you like to play tennis, couple days a week. If you go to the gym, you're doing CrossFit, you're doing any of those things. If you've had an injury, it's going to affect your hormonal balance. Tons of research out there, tons of it, not just anecdotal stuff, indicates that hormonal fluctuations, that are experienced, during like your menstrual cycle and biomechanics and movement patterns, how you move your body, the energy that you have behind it, potentially increasing your risk, by the way, of injury. So you can go either way. You can have injury that influences hormonal reproduction, or you can have hormonal reproduction that is going to predispose and put you at risk for injury. So for instance, let me kind of put it this way. If you're a female athlete, okay, not one of these crossovers, but you're actually an XX chromosome, particularly, in our world today, we have to differentiate those things, but that's me saying this. And, I want you to know the truth about how your body works. Female athletes may find it much harder, if you will, to balance and rebuild muscle tissue when their hormones like estrogens and progesterones increase. They go up too high. And because we need what? You need growth hormone, and you need the hormones that the adrenal system will use to balance tissue on to heal things. Now, when we have muscle loss, sometimes it's because there's an imbalance in those hormonal patterns. Estrogens get too high, they're out of balance. Progesterone doesn't work to balance it out. So that's called your estrogen dominant pattern. But also, if the hormones themselves, the progesterones, get way too high, they can lead to a greater risk of injury in the body. Now, let's get into the menstrual cycle pattern. in the luteal phase, where they get ready to germinate the egg, and it goes up, and estrogens go up and progesterones go up, which is 5 days just before your menses starts, right? So that's your ovarian rupture phase, meaning that the egg that's sitting in your ovaries now is ruptured. It increases. The covering around it, called the corpus luteum, degradates, breaks down. That causes your progesterone to go up. They reach a peak, and then if there's no fertilization, they drop off. That's the luteal phase. Now, there's been found that very specifically that phase is when you ladies, you have the greatest risk of injury when it comes to athletic anything. Okay. So if you're in your ovulation cycle, 5 days before you normally would have your menstrual cycle, and you're out there, you're pushing, you'll find that the risk of getting hurt because of that upregulated pattern is much greater than at any other time. So what should you do? Well, when you're training, maybe you go a little lighter on those days. You mark it on the calendar. You know when that's taking place, and you back it down just a little bit. Maybe you don't go to CrossFit. You do a little bit something gentle like yoga, or you do a very gentle Pilates class, not over the top, but very gentle Pilates class. Because if you don't, because of those increased levels of those hormones, your estrogens and progesterones, they predispose you to increased risk of injury. Guys, what does that mean for you? You say, well, I don't produce estrogens. Well, you actually do. They come from your adrenal system. And if your testosterone, and that's where it comes from, isn't converting properly, then you can produce bad estrogens, and it goes to bad testosterones, which is DHT. But let's back it up a little bit. In today's world, we're seeing more men that have breast cancers than ever before. And it used to be unheard of. Maybe less than 0.5% of all breast cancers were male way back in the day. Now, depending on the author that you read, it can go anywhere from 3, some authors will even say 5%. That's a lot. That's a big increase. Why is that? It's because of the environmental estrogens, the xenoestrogenics. Ladies, this affects you as well. But guys, when those estrogenic levels are increased, you also increase your risk of injury. So keep that in mind. If you have these man boobs that are starting to develop on you, that's telling you got a problem, and you got to reverse it. It can be done simply by looking at dietary patterns and so forth. But let's move forward. I want to talk to you about injury and how it affects the system in both ways. This predisposing you to injury, but now what happens when we actually have injury patterns that take place in the body. So hormonal, we can even say it's hormonal response to injury type of situation. So hormonal response to injury. Hormones, again, are chemically classified as something called polypeptides. And those break down into cytokines and glucagon and insulin. Interesting, right? You didn't know that. Hormones are broken down into polypeptides. There's cytokines, glucagons, and insulin, and something called amino acids. And they're like epinephrine and serotonin and histamine, or fatty acids. And those are glucocorticosteroids, those are prostaglandins, and those are leukotrienes. A lot of words, but I just want you to hear them. So if you decide you want to look something up, you can. Now, most hormone receptors generate a signal by one of 3 major pathways. Okay, so they overlap. So it's specifically receptor pathways that they regulate things like insulin and insulin-like growth factor receptors. Big word, right? What does that mean? That means that, take it from this piece, you got to have this, if you will, to stimulate other pathways along the way so your body stays in a normalcy without a lot of inflammation. Now, when these certain protein binding peptides, if you will, they stimulate neurotransmitters and prostaglandin receptors, and they allow your body to act the way it's supposed to. I mean, it's a lot of stuff, but activation of these membrane. Now, these receptors are in membranes, meaning tissue, and they signal different pathways to do certain things. Now, here's the thing. They will target your DNA sequencing and how your DNA expresses itself. Now, here's the key. This is something that I want you to understand. If we break it down very simply as this, when you have an injury, it blunts these receptor sites. So these things that you need, these insulin pathways, these glucagon pathways, these neurotransmitters that produce your prostaglandin receptors, your androgens, your testosterone, your estrogens, and so forth, they become blunted and they can't work the way that they were designed and meant to work. So what happens then? That means that your injury pattern sets up an inflammatory reaction that is carrying the wrong things to your DNA. Now, we've all heard DNA, so that makes it a little simpler. Every hormone in the body has this HPA influence. It's called, remember, we've talked about it repetitively, hypothalamus, pituitary, adrenal. And that hormone response that is mediated by the HPA axis influences how your body responds to injury and stress. Stress is injurious to the body. That's why we said stress kills. Now, direct influence of this HPA axis on what's called inflammatory regulatory response. So if you get hurt and you're in a constant state of pain, or you're in a constant state of stress, this dysregulation occurs, shutting down or overstimulating initially your hormonal function or reproduction. Once it's overstimulated, pretty soon it goes into a fatigue pattern and it begins to quiet itself down to the point where you got a problem. When I say quiet down, I'm talking about a dysregulated lowering of any hormone in your system. It could be insulin, it could be testosterone, it could be estrogen, it could be glucagon, it could be, cortisol, it could be any of those things. Let's take an example. Let's take a guy who's in his late 70s, 80s, and he's got a history of inflammatory reaction of pancreatitis, okay? And he undergoes a pancreatic debridement. It means that they're going to do some surgery and so forth. Subsequent to the procedure, the pancreas drains, the way that it picks things are found to contain an elevated levels of two hormones, amylase and lipase. When doctors see that, it says, we got to watch this because it may lead to cancer, or maybe cancer there to begin with. So, but the output from these markers, increases, once the patient begins a regular dietary pattern, and then the patient develops something called hypotension, low blood pressure. They develop tachycardia, and then they develop a inflammatory brain pattern and confusion. Now, all of that comes as a result of the dysregulation of hormone due to what? Injury, blows, traumas, surgical intervention. So you can do other things. People who've had medication ongoing for a long period of time, beta blockers, if you will. Epinephrine was given as the standard dosage for the treatment of something called anaphylaxis. The problem is that it begins to self-perpetuate its own problem. The epinephrine level has to get higher, and then it downregulates glucagon, it downregulates hydrocortisone, it downregulates norepinephrine. All these things have to be in balance for your body to repair anything. And if it can't do it, you have a problem. So look, a lot of confusion, a lot of things I just put out in front of you. But what I want you to get from this is that your body is going to go into a deteriorated state, if you will, as a result of injury of any kind. When we have unopposed estradiol peaks, when they go into a problem where you get cyclic variations in ligament elasticity. The ligaments become soft. And so you're more predisposed to injury. You turn quickly and you say, how did I hurt myself? So you have to look at something other than just what you did, but what was predisposed to it. If you have, if you're taking oral contraception, that increases your what? Your estrogens. You have to look at the knee itself. You can tell whether it's too much or too little just by doing some testing of the ligament structures of any joint space, but the knee is one that shows up simply because of the fact that you're on it all the time. You're moving it all the time, and you're having my knee hurts type of situation. Now, here's another thing that happens in injury. You take another blow, and if the corpus luteum, remember that wrapper around the ovum, ladies, is not working the way it's supposed to, it decreases your progesterone production. And that increases something called prostaglandins. And that increases something called your outside tissue contractions of any androgen area of your body, increases your blood flow. And then pretty soon you end up with tissue ischemia, not getting enough oxygenation, which then produces pain. I know that's a lot to deal with, but let's break it down simply. If for any reason you've had an injury pattern to the nerves that go to that area, disruption to the organ system itself, either surgically or a trauma or a blow, it can affect and dysregulate hormone production, your estrogens or your progesterones. And then that increases a dysregulatory pattern leading all the way down to problems with blood flow and the lack of oxygenation. And then what happens is you increase your pain pattern. Kind of crazy, right? But that's really the way it happens. Now, any injury to the body that causes hormonal dysregulation, if you take a blow to the head, if you take a blow to the pelvis, if you've had any kind of abrupt trauma to any of the organ systems, no matter where it's coming from, you can end up, if estrogens are off, you got breast tenderness, you got nausea, you have increase in blood pressure, you have brain accidents, meaning strokes and things of that thrombus formation in your legs, increase in cholesterol, simply because your estrogens are off, not because you're eating too much fat, not because of anything else, but also which metabolizes estrogens, your liver. So if you got liver toxicity or an injury to your liver, you got a problem. And then guess what happens? If you're in Menson's area, you got a lot of heavy bleeding. Progesterone, you have, if that's off, you got irritability. You increase your appetite. You put on weight. Your libido goes down the tubes. You have anal itching. And it's not just necessarily because it's from parasites. It can be, because if you get more at the full moon, it's probably parasitic. You're tired, you're depressed, you're bloated, you have headaches. That's progesterone levels. All of those things can end up and show up because of injurious patterns. Now, I don't know about you, but if you go to a lot of docs and they can't figure out why this is taking place, wouldn't it be great to find out? We're going to have an opportunity coming up this coming Wednesday evening on the 19th at the Roselle Center for Healing in Fairfax. Dr. Stephanie Pina and I are going to kind of lead you through the flow on this thing, if you will. And we're going to talk about what really takes place with hormonal imbalance, but more importantly, all these pain patterns that have dysregulated everything, does it have a far-reaching effect on how you're going to feel, how you're going to live, what your wellness index is, what your longevity index is moving forward? The short answer is absolutely 100% it does. So more importantly, how can you fix it? Guys, you too. How can you fix that low testosterone? How can you get that growth hormone to come back? How can you start feeling normal again and not grumpy, and you don't even like your own company. All of these things have to do with hormones, and it can predict your longevity, because if certain hormones are out of balance, your inflammatory levels go through the ceiling. And when you hear the term inflammation, I want you to think of acid. And if you're on fire, meaning acid, your body's got to put the fire out. How does it put the fire out? It puts the fire out by putting calcium in, which is alkalizing. Where does it get it from? It gets it from your bones. And then subsequently, what happens? Well, you become osteoporotic. Guys, you too, unfortunately. And then we're going to talk about something called vitamin D as well. Because vitamin D, some people are calling it a hormone. And I want you to know why that is and why it's so critical and so important to your immune system, to your health generally, to your hormonal balance across the board. It's an amazing little piece that so many of us forget. And if you live anywhere in the northern latitudes, somewhere around, the northern part of Virginia and upwards, most people up here are vitamin D deficient. And that's one of the main reasons they have hormonal dysregulation. If you ever had a blow to your head, any kind of trauma, you're going to dysregulate your hormones. If you ever had back pain, you're going to dysregulate your hormones. Why? Because those are the nerves that go to the testicles, that go to the ovaries, that go to the uterus, and so forth. A lot of patients, young women, come into chiropractic offices with bad menstrual cycles, but what brought them in was back pain. All of a sudden, the back pain goes away through treatment, and they normalize their hormonal flow. The upper portion of the neck as well, the vagus nerve that comes off the cranium, the brain itself, affects every organ all the way through. So if you ever had a blow or trauma, you've had neck pain, you've put up with it for a long time, you're taking medication to deal with it. God forbid you're going out and buying into the nonsense you're seeing out there with Botox, and you inject the back of the head. You got to remember something about Botox, my friends. Botox is a poison. It's not something that's your friend. It paralyzes the neurological system. And if you use that on a regular basis, I promise you, you're going to end up with trouble that you don't want to have. And it's not going to help your hormones, not even a little bit. So understand, when you have any kind of blow or trauma to the head, any blow or trauma to the body, it will influence the expression of hormones throughout your body, no matter where they are. If you get hit in the lower part of your back, those are the nerves that go to the pancreas. If you're putting up with back pain, that can cause you to be pre-diabetic, simply because the signaling isn't working the way it's supposed to. If you get hit at this area of your neck and the upper part of your head, guess what happens? You could end up with cardiovascular dysregulation, simply because those are the way the nerves go. But we're talking about hormonal production. If you get a blow to the back of the head, that's where your pineal gland is. And it can dysregulate all kinds of downstream control that, remember, we talked about, I think in the last program, we talked about circadian rhythm. It's important. It's incredibly important that you understand that you can't let this stuff sit without it being affected and addressed. So join us the 19th, coming up in a few days, and at 6 p.m. at the Roselle Center for Healing, 6 p.m. And register today. Go to drtomroselle.com. Go to rosellecare.com. You want to do it the old-fashioned way, you can always call the office, 703-698-7117, 703-698-7117, and join us. I think this is going to be a program that you don't want to miss. It's going to be one that is going to kind of finger point to some of the things that are going on that you don't want to have going on. But I promise you, we'll be there to answer all your questions. Having said that, I hope you enjoyed this program. And remember, I'm here on an ongoing basis for one reason only. I love you all. You have a great day. Bye.